Hello, my name is Michael Sliwa, and today I'll be talking about how we could save lives through garnering attention and innovating prison healthcare reform efforts. So, starting at the problem, we should talk about three main areas, which is who is affected, what is at stake, and why is this happening. So, first of all, prisoners in several facets of the prison system, especially those needing prescription medicines and the mentally ill, are affected widely by this issue. These are the main demographics and the ones that are most closely linked with the data and statistics that I found through my research. And in terms of what is at stake, I mean, we have the lives of millions of Americans, even though they are in the prison system and may have done some bad things in their life. They're still human beings and they still should be getting treatment. And along with this, it creates a breeding ground for even more detrimental health issues, which again is a very negative thing and will lead to people continuing to have these issues throughout their lives, even if they wouldn't have had them previously to being put into the system. And then this is happening because the system is based on outdated ideologies and it ignores the needs of prisoners. It doesn't hire enough staff and it's doing really nothing about the issue despite being aware of it. And again, this is evident through some of the research that I did. So when we're looking at this issue and we're trying to solve it, we should be looking towards our target audience, and that should be the general public, followed by the government at various levels, which would be local, state, and federal. And this will make a little bit more sense once I get into my proposed solution. So the public can outline the needs and fight for the reforms that are needed across the board. So they're kind of the driving force that can actually make some change because right now, really nobody is. And they need to care about these, reforms, and they need to care about this issue because it'll improve their community and it will improve the quality of life of others around them, which I think is always a positive thing and things that people should look to do. Along with that, the government obviously is the one that can put these reforms into action because no matter how much the public is rallying for a certain thing, the government is the only place that really has the power to actually do anything about it, at a fundamental level and at the level of instituting laws and things of that nature. So they've avoided these issues for over 50 years and they've been aware of them and they've started putting some changes into effect dating all the way back in the 70s, but from that point forward things kind of stagnated, especially over time, and in the current day really nothing is being done to help these prisoners out. So, in putting this plan into action, the best place to reach out to, in my opinion, would be the Prison Fellowship. Now, they're a nonprofit organization based out of Washington, D.C., which is basically, the epicenter of the United States and our government. So, that's a really good thing, from the start without any changes. And they hold events centered around brightening the lives of prisoners, along with informing their community members about the ways that they can be supportive of those prisoners as well, which obviously is probably going to be the goal long term of these reform efforts. So they already have a sizable reach and a well formatted approach to the issue and holding these events. So they're pretty much a perfect candidate to actually go ahead and just reform what they're doing a little bit and change what they're doing a little bit to kind of move towards, rallying the public towards reform efforts. So, as far as the thesis, the Prison Fellowship should work towards informing the general public about potential prison healthcare reforms through the use of data and firsthand accounts of injustice in order to appeal to the public's pathos. They can then use this campaign to propose an improved plan of action to the government, which should focus on revamping screening systems, instituting more personalized care, and updating current policies such as Medicaid. So there are four steps to this solution, and they are all pretty general, but can be expanded on over time and as needed. But the four steps really are: first, gathering past supporters to educate them; second, expanding their reach, of the prison fellowship, and that would either be online through maybe events or social media and things of that nature, or in person through specifically events. The third being approaching smaller scale governments at the local and state level, and that would be done through the supporters of the movement. And then finally, snowballing until the federal government is aware of the severity of the issue. So kind of building and building and building and accumulating, more and more attention until, it can be brought to the attention of the main federal government. And that's when the most reform would be able to be put into place because, legislators would be able to, know what they actually need to take care of and what the public actually wants. So, so in terms of the details of the solution, we have to talk about the five W's and the one H. So the first would be who, which again is the general public and would be more dedicated community members, people who are actually going to want to hold events locally in their own states, outside of what the prison fellowship would specifically be doing in their own community. And then also the prison fellowship, obviously, because they're the one that would be kind of the catalyst for everything and kind of organizing things. The what would be spreading awareness, attending events, holding events, petitioning government officials, and being a part of the movement. So that's kind of what people should be doing as they're a part of this movement, and it's what's basically going to get things kind of like the ball rolling to kind of reach the government. So then, where obviously it would be starting in Washington D.C. and then it would be followed by spreading across the country through events, and that's kind of the main goal of this, is to kind of get a lot more reach and awareness. So by spreading throughout the country, you kind of get that inconsequentially. And also along with that, kind of touching on the idea of going online, since, the online reach is extremely massive in the current year, especially with technologies, advancements and all of that. So then continuing on from that, we have the when, which would be better sooner than later, because this issue has been around for 50 years. It should probably be taken care of quite promptly. And then getting into the why, the issue has shown like no signs of subsiding over the past 50 years, and it's continually ignored. And if it's continually ignored over time, it will never really resolve itself. And then finally, the how is showing that there's no support for change, and that unawareness has been the biggest factor in keeping things the way they are. So just again, kind of playing on that whole awareness thing and spreading the message. So getting into more specifics, step one would be holding informative events, inviting speakers well versed in the topics, such as people who have talked on TED Talks, because that was some of the research that I did, was watching some of those videos, and I found them to be really influential and very good at explaining the issue. And also explaining the facts through data, as there's plentiful data to show the different issues that the system is facing. And then expressing the severity of the issue through firsthand accounts, either through those people who have worked in the system through the TED Talks, or other prisoners who might want to speak up, or pretty much anyone that would be well versed in the topic. The second step would be expanding into other cities and states, as I mentioned earlier, because that spread is going to be really, really important in getting the ball rolling and getting people aware of the issue. And in doing that, they should also focus on building an online presence, hosting online events, and then reaching out to popular social media platforms for partnerships or sponsorships. I think this would be a really innovative way to take care of things, in kind of a specific way they could. I know that Twitch is one platform that's a live streaming service that has worked with organizations in the past. One streamer raised like a few $1,000,000, within a 24-hour live stream for St. Jude's Children's Hospital. So I think the same exact effect can be done through an event hosted through one of those sites. And then step three would be calling supporters to specific action, which would be contacting, their smaller scale state governments and, local governments, and basically through reaching out to officials. This is something that people do very often when they want to change. And I think it would be really effective in getting, more powerful supporters, in the sense that they could actually, work their way up the chain through the government to actually reach even higher ranking officials. And then also urging people, in their own local area to hold their own organized events. And that would kind of play along with the step two, but just a little bit further along, and maybe getting government officials to help host those events as well. And then step four is petitioning the federal government directly, and that would be with help from supporters and the previously contacted government officials. And this would really just be the final, ultimate goal, would be actually getting, a lot of supporters together and showing that this is a big issue, as that would get things pushed through the system much quicker, and it would get us some good reforms that are backed by evidence and what people actually have seen firsthand. So although the solution has a lot of good to it, there are a lot of counter arguments. One such counter argument might be the fact that by only focusing on statistics and these firsthand experiences, not every person or situation is accounted for. And this is actually backed up by my research as well. As there may be some blatant holes in reform. So one example I had is that maybe somebody who received medical attention in the statistics might not have been positively affected by the system. So for example, 1 out of 5 people actually continue receiving medication after they are given it in prisons, and other than that, the other 4 out of 5 do not receive that same medicine that they need. So maybe they were before, kind of treated and prescribed medicine, but now they're not being prescribed that medicine. So that's kind of pulling on that. And then along with that, this could give government officials supporting the cause a bad rep because, if not everything is covered as, potentially promised, then these holes in reform will make them look bad. To justify against this counter argument, this is, as I said before, this is exactly true, but that's not having to do with the aim of the efforts, which is actually to get the ball rolling. And, since there's no movement currently, any movement towards, getting this reform done would be great. So, this problem has not subsided since the conception of these systems, and the government does not show any signs of stepping in on their own. So, if a sizable number of American citizens come together and actually, bring this issue to the spotlight, then things will start to be done about it, and people will be more aware. And, these American citizens will not be dying in jail due to these inadequacies anymore. And, we need to start somewhere. Other problems can be addressed in future efforts. So, we're kind of laying the foundation as well. So to conclude, if nothing is done regarding this issue exposed here today, hundreds of thousands of prisoners will continue to be neglected every year and even die. And in making this cohesive plan filled with several effective aspects of reform and, different efforts that can be made and steps towards getting awareness going, it's at least guaranteed that some awareness will be garnered and spread and that people will come to understand this issue and be able to do things against it in their own communities. So with that being said, that's about all I have, and thank you for listening.